Hello friends, welcome to BMH Learning. In this video, we are going to talk about anti-double-stranded DNA antibodies. Anti-double-stranded DNA antibodies are a type of anti-nuclear antibodies. These are actually autoantibodies. Autoantibodies are generated when the immune system fails to correctly differentiate between self and non-self. So they mistakenly attack the body's own healthy cells, which cause tissue and organ damage. These antibodies basically target the antigens of the double-stranded DNA. So you can say these anti-nuclear antibodies target the cell's nucleus where genetic material is present. Now, what is NDS DNA antibody test? The test identifies the presence of anti-double-stranded autoantibodies in the blood. Although anti-double-stranded may be associated with a number of disorders at a low level, but it's primarily present in lupus. We can say SLE, that is systemic lupus erythematosus. The anti-DS DNA test is fairly specific for lupus. It's known that 75 to 85% of people with lupus may be positive for anti-DS DNA. That is, a negative anti-DS DNA does not rule out lupus. So, if a person has a positive ANA, in that case, an anti-DS DNA test may be used to distinguish lupus from other autoimmune disorders that have similar signs and symptoms. Also, if the patient has a positive ANA test result and along with this the patient also shows symptoms similar to that of lupus, in that situation ELISA test is highly recommended. Why the test is ordered? The test aids in differentiating lupus from other autoimmune diseases that may have been bothering you. It helps in measuring the severity of the diseases in patients detected with lupus and lupus nephritis too. When the test is ordered? The test is ordered when a person shows signs which are generally associated with lupus. Your doctor may also ask you for this test if you show a positive ANA test, specifically when the report of the ANA test presents a homogeneous, or we can say speckled fluorescent pattern. You should go for this test if you find the following symptoms: muscle pain, arthritis, like pain in one or more joints, and this is when there is no or a little joint damage, rut rashes, which frequently resembles a butterfly across the nose and cheek areas, low-grade fever, persistent fatigue, weakness, skin sensitivity to light, hair and weight loss, numbness or tingling in the hands or feet, inflammation and damage to organs and tissues, which include the kidneys, lungs, heart, lining of the heart, central nervous system, and blood vessels. The test can be ordered periodically to monitor progress of the disease or flare-ups in a person who has been diagnosed with lupus. The test may also be repeated when the initial test report is negative, but the clinical signs and symptoms are still there, and thus SLE is strongly suspected. Now, what do my test results mean? First of all, the ANA test report is analyzed. If the test shows positive result, the ELISA test is done in order to rule out anti-DS DNA in the blood. So if that result also happens to be positive, that is, if the patient is found to be positive for anti-DS, lupus is inferred. Now this doesn't mean the lupus is confirmed. So if the level of anti-DS is high, lupus nephritis is usually concluded. And if the levels are moderate, it's thought to be associated with other autoimmune diseases like Sjogren's syndrome or MCTD, that is mixed connective tissue disease. And in case when the DNA results point low levels of NDS, it usually signals that you should not be worried about. But that doesn't signify at all that lupus has no role to play in your condition. This was all. Thanks for watching.